Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is 𝐍.𝐈.𝐂.𝐕.𝐃 and welcome to Pakistan Super League, Pakistan Cardiac Super League Season 2 presented by Pakistan Cardiac Society and powered by Wilson's Pharmaceuticals. Today we are live for the second match of the group stages. The first match was played between PSC Warriors and MIC Panthers, which was won by MIC Panthers. And now we are live for the second match of the Group A, two teams, NICVD Kings and Civil Falcons. Allow me to introduce the faculty members who will be joining us in shortly. Today match umpire will be Dr. Professor Ishaq Saab. He will be the match umpire, and with the passage of time, second match umpire Dr. 𝐊𝐈.𝐃 Siddiqui and guest panelist Professor Nawaz Ashari Saab will also join us today for this match. And I will now hand over the mic towards the moderator of the program, Dr. Hamza Ghori Saab, to please, and I will request him to please start the proceeding of the match between NICVD Kings and Civil Hospital Falcons.
Yes, thank you very much, Hamza. So we are back again. And as we all know, it's the second season of Pakistan Cardiac Super League, which is brought to you in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. We are into the Super Sixes. We've already had one match, and today is going to be the second match of Super Sixes. And it's going to be between NICVD Kings and Civil Falcons. So I'm expecting a good game, a tough game, and that's what we are all here for. Yes, we do have the umpires and panel members, very important to us, especially the umpires, Professor Mohammad Ishaq Saab, our second umpire for the game, Professor Abdul-Hamid Siddiqui, and we also have our worthy panel members, and we will be introducing them as they join us in the game today. All right, with this, I'm going to move towards the two teams. So I'm randomly going to ask one of the teams. You know the drill. The captain will give the introduction of his or her team. Please go ahead. NICVD Kings.
Assalamu alaikum. I am Dr. Kainat, the captain of NICVD Kings. On my right, he is Dr. Shahir, and on my left, Dr. Shidba and Dr. Sumaira. Thank you.
Welcome to the game today and best of luck to you. All right.
Thank you.
Civil Falcons, can we have them on the screen? Introductions, please.
Assalamu alaikum. I am Dr. Mohammad Fad, captain of the team Civil Falcons. On my right is Dr. Aima, and on the left is Dr. Samina. And all the best to the opposite team.
Yes, I think that's a wonderful sentiment. Wishing each other best of luck, and I think best of luck to both the teams. We are hoping for a good match today. So, moving to the all-important toss. It's an electronic coin toss, and can we have the coin on the screen? I'm going to request randomly Civil Falcons to call heads or tails.
Heads.
All right, roll the coin. And it's heads. All right, so I think the luck is favoring you. Civil Falcons, you won the toss, and I'm going to pose you with two questions. First one, whether you want to throw the questions or you want to take the questions.
Well, we will like to throw the questions, ask the questions.
Okay, so they want to ask the questions. Good. Now the second question, you have two options, case A versus case B. Which case you want to select?
Case A.
Okay, so they have gone with case A. Now the news from the center is Civil Falcons have won the toss and they want to ask the question, and they've selected case A. Can we have the vignette, the scenario on the screen? And I'll ask the Falcons to read it, please.
Okay, can I have question on the screen, please?
Okay, yes, so you have the question on the screen, and Civil Falcons, you can start reading the question.
65-year-old women, it's disappearing again and again.
Can't see the screen?
As soon as I speak the question, yes, as soon as I speak, the questionnaire disappears.
So I'll request the technical team to support them and help them out.
You have to pin the Cardiac Super League window. Naseem, if you're listening, please pin the Cardiac Super League window.
Have you pinned the Cardiac Super League window?
हाँ, तीसरे नंबर पे हाँ okay. A 65-year-old man with chronic systolic heart failure, EF 30%, presents with worsening dyspnea on exertion, now occurring with minimal activity. He reports using two pillows to sleep comfortably but denies significant weight gain or worsening leg swelling. His medical history includes hypertension, hyperlipidemia, type 2 diabetes, obesity, and a history of anterior wall MI with PCI to the LAD and RCA. Current medications include aspirin, sacubitril, valsartan, metoprolol, spironolactone, pyrazinamide, rosuvastatin, and empagliflozin/metformin. Vital signs shows BP of 162, heart rate 60. On examination, he has distant heart sounds, 2/6 systolic murmur at the apex, 1 plus fetal edema, and elevated JVP at 15 centimeter of water. Echo reveals LVE of 30%, a dilated left ventricle LV ESD 45 mm, and diastolic dimension 62 mm, severe MR and an RVSP of 59 mmHg.
Okay, so we do have an image as well. It's the ECG. You can take a look at it. And I'll give you a couple of seconds to go through the scenario. I know it's a long scenario, King, so you can have the scenario if you want it. Yeah. Okay, so Kings, are you ready?
Yes.
लेकिन पेशेंट इसका क्लियर में नहीं है
नहीं
Worsening के साथ.
Okay, so mute the mics, please. And we are going to have the first question on the screen. Read it,
Which
please.
one of the following is the best next step to reduce this patient's mortality? Mitral valve surgery, cardiac resynchronization therapy, IV nitroprusside, IV dobutamine, transcatheter H2H mitral valve repair.
And
Over
60
to you.
seconds on your screen. The answering team can unmute now. We would like to hear the discussion.
तो सीआर
We would like to select option B, cardiac resynchronization therapy.
All right. So are you sure?
बीटा
Option B,
Yes.
beta. Okay, they seem to be confident. They want option B, beta. Lock option B. Yes, that's a 6. Well played. Very nicely done. Good start. So, that's a wonderful start. Now let's move to question number 2. Read it, please.
3 months later, despite CITD, the patient is still symptomatic with MEA class 3 symptoms. Vital signs include BP 162, heart rate 60 with normal oxygen saturation. In which class does the patient fall? According to the Intermax classification, options are Intermax 1, 3, 6, 9, 5, and 7.
Okay, your timer starts now. So, Kings, you can unmute yourselves because we would like to hear the discussion.
Intermax.
3 to 4 मेरे ख्याल से 4 और 3 कम होगा
बहुत
Approaching 20 seconds.
3 या 4
We would like to select option C, Intermax 4.
Okay, they want to select C, Charlie. Option C to be locked, please. You missed it by a big margin. All right, all right. Never mind. You still have 8 more questions to go. With this, we move on to question number 3.
3 months after CITD, patients remain symptomatic with class 3 symptoms. P 162, HR 60, oxygen saturation normal. Coronary angiography shows mild non-obstructive coronary artery disease with patent LAD and RCA stents. Right heart cath reveals the following: RA 15 mmHg, RV 64 by 12 mmHg, PA 66 by 30, mean 42 mmHg. PCWP mean 35 mmHg, cardiac output 4.5 liter per minute. Cardiac index is 2.6 liters per minute per meter square. What is the next best step in this patient's management? Option A is percutaneous MV repair. Option B is surgical MV repair. C is left ventricular assist device. D inotropic support. E is cardiac transplant.
And your 60 seconds start now.
वेंटिकुलर असिस्ट डिवाइस लगा
पेशेंट ऑलरेडी ऑप्टिमाइज ट्रीटमेंट पे है, सीआरटीडी भी हमने दिया है अभी भी, लेकिन उसका जो है सिवियर एआर जो है एमआर उसको जो है बैकफ्लो हो रहा है, जिसकी वजह से ये सारे फैक्टर बढ़े हुए हैं।
बेस्ट की पूछ रहे हैं, बेस्ट में तो फिर हम पानी की तरफ नेक्स्ट टाइम
तो ये वेल्वुलेट थेरेपी आपको जाना
पहले हमें वेल रिपेयर करना है,
माइक्रो कैसे रिपेयर करें
एज टू एज जो हम करते हैं कोऑप ट्रायल।
हाँ इसमें
एज टू एज हम क्लिप्स करा।
माइक्रो
हाँ, we would like to go with option A, percutaneous mitral valve repair. Percutaneous.
All right, so you want me to lock
It's got
option
mortality
A
there.
alpha. Are you sure?
Yes.
Okay, they are sure. They are trying to hit it over long on. Lock option A. And yes, that's a huge 6. Very well done. Very well played, Kings. Nicely deciphered. That's good thinking. Good job. So, we now move to question number 4.
The current criteria of EER transcatheter end-to-end repair is based on which trial? WAP trial, MITRA trial, MIC last study, Everest trial, TIER Pascal trial.
All right, timer starts now. 60 seconds.
Option A, co-op trial.
You've really come down the wicket. You are going for a big 6. Again, it's a straight drive. Is it going to be a 6? Are you sure?
Yes.
Okay, option A alpha. Lock option A alpha. Oh yes, very well played. Well done. Great going. We are all looking for a good total today, so that it really shows that we are in the super sixes. Now moving on to question number 5.
Which of the following characteristics is not part of the desirable criteria for percutaneous atrial repair of MR on echocardiography? LV 20%, LV in diastolic diameter 65 mm, TEPC 15 mm, PAP 65 mm mercury, E none of the above.
And your 60 seconds are on your screen.
हाँ
जब एलवी सिस्टोलिक डायमीटर बढ़ेगा मतलब पेशेंट रिवर्सिबल नहीं है।
एग्जैक्टली सही है
वो हमारी
So I'd like to take this opportunity to welcome our worthy panel member, Professor Nawaz Lashari. He's with us. Welcome, sir.
लेकिन मुझे बस ये याद नहीं आ रहा ये 70 था या 65 था।
बाकी ऑप्शन पे एक्सक्लूड कर लो ना।
दूसरी चीज
हाँ
We would like option B, LV end systolic diameter 65.
Okay, you want me to lock option B beta, right?
23 में जवाब
Option B beta.
आई थिंक डी
Okay, lock option B beta. Oh, that's another blemish. The second one, never mind. You can still put up a good total.
70 होगा इसका।
Okay, and I think the teams are pretty aware. They're giving a good fight. Moving to question number 6 on your screen, please.
Which of the following characteristics is not part of the desirable anatomic criteria for percutaneous atrial repair of MR using mitra calip? Coaptation length more than 2, short leaflet, short posterior leaflet, flail width less than 15, MV orifice area more than 8, and MV leaflet length more than 1 centimeter.
And your 60 seconds start now. So I'd like to welcome Dr. 𝐊.𝐕.𝐃 Siddiqui Saab. He is the umpire and he has also joined us. Welcome, sir. that's an off cutter, and we have 20 seconds to go. Come on, Kings. Where are you? We don't hear anything. 15 seconds. NICVD Kings, are you there? 7 seconds. I don't hear any response. 4, 3. I think they are not there.
जी हम
Your time's up. You haven't answered.
हमारा इंटरनेट डिस्कनेक्ट था
Okay, I think there is a technical issue there because we were not hearing anything from their end. So I think we'll do we? Yes, I think we have the umpire on board, Professor 𝐊.𝐂.𝐕.𝐃. Siddiqui. Sir, are you
Hello?
there?
am I
Okay, I can hear you. NICVD Kings?
Yes,
Can you
I'm
hear
here.
us? Okay, so we had a technical issue.
I
They were.
think,
I
I
think
think
we.
there was yes, I think there was technical issue because we couldn't hear any answer from the team,
Exactly.
and I don't know whether we can just give extra time, extra 10, 15 seconds. I think
Yes.
first sort out the issue whether they are able to they are audible or not.
Right, right, sir. I think we'll check that. So, Kings, can you hear us? Please talk to us.
we yes we can hear you
Okay, sir, should we give them 10 to 15 seconds? 15 seconds, would that be
Yes,
fine?
I think that should be okay.
Okay, we are giving Kings extra 15 seconds. Come on, answer please.
option B short posterior leaflet
Okay, so they have mentioned it's option B. B beta. Lock option B, please. Beta. And yes, very well done. I
we
think it
cannot
was
hear you sir
very well done. Can you hear me now? Can you hear me now? Okay, I think they're having a technical issue over there in Karachi. NICVD Kings, they are unable to hear us, and we lost contact with them right in the middle of this question.
कितने सही हुए
Okay, NICVD Kings, can you hear me now?
वो जो नील लगे ना वो
मेरा
So I will request the technical team to look into it. NICVD. Kings, are you there? Okay, so I'll give some time to the technical team to sort this issue. So Civil Falcons, are you there?
Yes, we hear.
Okay, so Civil Falcons are there, they can hear us. So the technical issue is at NICVD's end, and they are sorting it out. Okay, so I think Kings, are you back? Can you hear me?
yes sir yes sir
Okay,
are we
so
audible to you
yes, we can hear you now. We do understand there is a technical issue going on with the internet, but we'll try to make it convenient for everyone, and the technical team is there to help us. So well done, that was the right answer. It was the obvious answer. Well done. So I'm now going to move to the next question, please. Can we have it on the screen?
Which of the following statements is correct regarding transcatheter edge-to-edge repair of the mitral valve for heart failure patients with secondary MR? TR is contraindicated in patients with PASP greater than 40 mmHg. TR results is superior outcome compared with surgical valve repair when
the
there
screen is blurred sir
uncompleted epithelial
Okay, hold
coronary
on,
artery disease.
hold on please. Can you see the screen properly? Is it there?
No, we can't see.
not the question vignette we cannot see it clearly
Okay, I'll request the technical team on ground to please facilitate them. Even if you have to give them the handouts, do we have any hard copies or telephone, mobile phone available? So, do you have the question now?
Yes, sir, we have.
Okay,
We have
please
it.
continue with the options, Civil Falcons, quickly.
Okay, option D, spear clips are typically developed of the mitral PSP segments of the mitral valve, and E is none of the above.
Okay, so the timer starts now, 60 seconds. So I'll request everybody else to keep their, I'll request everyone else to put their mics on mute, please. Only the answering team to keep it unmuted.
हाई ग्रेड एपिकार्डियल डिजीज है तो रिपीट कर लें.
ए से
मतलब कि clips are typically displayed in media segment.
20 seconds to go. Come on.
ये करें. सी
वाला लग रहा
सी लग रहा है ना.
mortality and heart failure hospitalization.
10 seconds. Come on. Come on, Kings. 8.
Option
7.
option C.
Okay, they want us
Option
to
C.
lock option C, Charlie. All right, lock C, Charlie. And yes, very well played. Very well done. Good shot. That's a wonderful stroke. Truly going for a 6 and well done, I think. That's very well played. All right, so in between, I think I'm going to request everyone who's there to please keep the mics on mute so that the answering team, which is the point of focus at that time, can actually communicate properly and we can all hear them. Thank you very much. Please check your mics, all of you. All right, now the next question is question number 8 and we have reached a score of 30.
What is the recommended?
Go ahead.
Next question 8 is what is the recommended anticoagulation strategy for patients undergoing transcatheter mitral end-to-end repair? A. Aspirin alone, B. Aspirin clopidogrel, C. Warfarin alone, D. Warfarin and aspirin, E is Vax alone.
And the timer starts now. Kings can still put up a good total. They are in striking distance of a good total. Yeah, the answering team.
I think हमें ना एस्पिरिन अलोन देनी चाहिए क्योंकि हम टावी के बाद भी हम एस्पिरिन ही देते हैं
और इसके अंदर कोई हमने
और अब एफिब नहीं था पेशेंट को, एफिब था भी नहीं पेशेंट को तो वार्फरिन का और उसका ड्रग्स का कोई रोल नहीं बनता. तो मेरा ख्याल है ए होना चाहिए इसका एस्पिरिन. We would like to go with option A, aspirin alone.
Are you sure? You want me to lock option A, alpha?
Ischemic disease भी तो है.
Yes, option A, aspirin alone.
Okay, lock option A, alpha. Lock it, please. Oh goodness, there is ischemic heart disease. Somebody mentioned, I think the team
वो तो
was
पहले
not.
हो चुकी है.
Okay,
पहले हो चुकी है वो.
I think the team here, you know, they were not sure, but I think still well played. You missed it, but you were very close to it. Anyhow,
ये पहला है.
ड्यूरेशन ये कब हुआ था?
okay, I will request the teams to mute the mics and we'll now move to question number 9, the second last question.
What's the Carpentier class of this patient's MR? Class 1, 2A, 2B, 3A, 3B.
All right, your 60 seconds start now and I'll request you to please tell the
Carpentier
options
class.
as well. Yes, Kings.
We would like to go with option A, class 1.
That's very quick, came down the wicket. I think you've taken a big swing. You want me to lock A?
Yes, sir.
Okay, lock A, alpha. If Ishaq Saab was there, he would have told you to utilize your time. A bit hasty there. All right, all right.
Restricted था period.
नहीं. Restricted होता है 3 में और वो होता है
3B है ना.
3B.
ये कह रहे हैं.
Okay, teams, focus here now. We still have the last question. Let the bygones be bygones. Kings, you can still put up a good total. Concentrate. Last question, question number 10 on your screen.
IMR is a dynamic lesion and MR severity can vary over time and during exercise. Which of the following statements about IMR during exercise is false? Severity of IMR at rest predictably determines the severity of IMR during exercise. Exercise-induced increase in IMR provides additional prognostic information over resting. Exercise echocardiography may be used to further evaluate patients with exertional dyspnea out of proportion to the degree of resting IMR. An increase in EROA of more than or equal to 13 mm during exercise is associated with increased mortality. Increase in EROA of more than or equal to 13 mm during exercise associated with increased HF hospitalization.
And the timer starts now. Kings, unmute please.
So exercise echocardiography may be used to further evaluate patients with exertional dyspnea out of proportion to the degree of resting MR. इस एक पेशेंट को अगर आउट ऑफ प्रोपोर्शन पहले ही डिस्निया है तो हम उसको एक्सरसाइज echocardiography क्यों करवाएंगे? अब ये पूछ रहा है हमसे तो which of the following statement about MR exercise is false? नहीं राइट करना भी चाहिए तो राइट कैच करना चाहिए तो सी मुझे लग रहा है ऑप्शन सी exercise echocardiography may be used to further evaluate patients.
So you want me to lock option C? Are you sure?
Yes.
Should I lock it? C, Charlie?
Yes.
Okay. They want me to
Care
lock
करेंगे ना
option C.
out of proportional symptoms है severe MR में.
C, Charlie. Lock it please. Oh, another miss. Well. I guess with this we now come to the end of this first innings. It's a mediocre total, not too bad, not too high. I think we are still in the game. Both the teams are pretty much there. So the score to beat is going to be 30. And with this, I think now that we are in the halfway stage, I think we would like to take our panel on board, and I would like to take their views as well. So we have Professor 𝐊𝐈.𝐃 Siddiqui Saab. Sir, your opinion, your thoughts?
I think I have joined a bit late. They have put on a reasonable total. It was a good topic. The questions were very appropriate. Anyway, let's see what the other team brings to this total.
Thank you very much, sir. It's always great to have you there and to see you. I think your support has been instrumental throughout, and everybody looks up to you there. It's been a bit up and down. I think it's a mediocre total, 30, not too bad, not really beyond the reach of Civil Falcons, but I think they'll still have to put up a good fight. And with this, I think without much ado, I think we're now going to move to the start of the second innings now. All right. So can we have the scenario, case B, on the screen? Read it, please. Kings, go ahead.
The case is a 28-year-old unmarried lady presented to the ER in collapsed state with atypical chest pain and dyspnea NYHA class 3. Her past history was significant for an episode of mild COVID respiratory illness 3 months ago, while she was on a holiday trip in Europe, from which she made an uneventful recovery. Her clinical examination revealed a young, sick-looking, distressed lady with respiratory rate of 38. Her pulse rate was 134 beats per minute, while blood pressure was 85/60. Chest examination reveals bibacillar crepitations up to mid-zones. Her ECG shows run of non-sustained VT and generalized T-wave inversions. Her hemoglobin was 8.2 and her high-sensitive troponin was 55 picogram per milliliter.
Okay, so Civil Falcons, you can take a couple of seconds to gather yourself. So let me know when you're ready.
If you can hear us, we cannot hear you right now.
Okay, you can't hear me? Okay, so where exactly is the issue? Is it with Civil Falcons? Now we have an issue at their end. All right. So Civil Falcons, can you hear me? Okay, I think there is again a technical issue going on, and I apologize on behalf of the technical team and the organizers, but it's the internet which makes it difficult for everyone at times. So I do hear a lot of crosstalk. Whose mic is open? Whose mic is unmuted? Because I can hear somebody there.
लैपटॉप का स्पीकर है लेकिन उसकी इतनी हाई फ्रीक्वेंसी नहीं होगी ना.
Okay, so I think we'll take a moment. They're trying to fix the issue. All right, technical team, I need something from your end. What's going on? Okay, so I've just been told we've been joined by Professor Mohammad Ishaq Saab. Sir, great to have you. So I'm just going to brief you on a couple of things. We are having a technical issue at the moment. We have just lost 𝐍.𝐈.𝐂 Falcons, and they were about to start their innings. And NICVD Kings have put up a score of 30. That's the news
30.
from the center. Yes.
Okay. So the other team is yet to start.
Yes, it's 𝐍.𝐈.𝐂 Falcons, and suddenly there's a technical issue, and the team is sorting it out there. So we can have your thoughts. I think it's a mediocre total, but we're hoping for a good fight.
Yeah, I reviewed the questions last night. Both are quite difficult ones and very long scenarios, which I keep telling my friends, please make a short scenario.
Yeah.
But anyhow, both the questions were comparable, so balance bilkul equal hai. So let's see the other team how they perform. You never know, sometimes they come up with surprises. And
𝐍.𝐈.𝐂 Falcons, are you there? Are you there? Can you hear me?
Yes, I
You can hear me. Okay. So now can we get back to the game? Can we have, and the match at hand, so can we have the scenario on the screen, please? All right, this is the scenario. So quickly go through the scenario, Kings.
A 28-year-old unmarried lady presented to the ER in collapsed state with atypical chest pain and dyspnea NYHA class 3. Her past history was significant for an episode of mild COVID respiratory illness 3 months ago, while she was on a holiday trip in Europe, from which she made an uneventful recovery. Her clinical examination revealed a young, sick-looking, distressed lady with respiratory rate of 38 per minute. Her pulse rate was 134 beats per minute, while blood pressure was 85 by 60. Chest examination revealed bilateral crepitations up to mid-zones. ECG shows runs of non-sustained VT and generalized T-wave inversions. Her HP was 8.2 and high sensitive troponin was 55 picogram per milliliter.
All right, so 𝐍.𝐈.𝐂 Falcons, are you ready now? We are now going to move to question number 1. Are you good? Falcons, can you hear me?
Yes, please.
I will request everybody else to keep your mics on mute, please. Only the teams to be unmuted. We can hear a lot of crosstalk from everyone. I'll request you one more time to please keep the mics muted. Thank you very much.
Okay, so should I read a question?
Falcons, are you there? Civil Falcons. Civil Falcons, I think I'm not getting any response from them. Technical team. Falcons, can you hear me? Falcons.
Audionic, the sound master.
डॉक्टर फहद प्लीज आप मोबाइल को म्यूट पे रखें और मोबाइल को माइक्रोफोन से दूर रखें प्लीज.
Okay. Okay, I think you have to keep the mobile away from the mic because otherwise there's going to be a lot of distortion. Technical team to please help them on ground. Okay. So, Civil Falcons, are you good? Can you hear me? Falcons, I think they can't hear me.
नसीम लैपटॉप को भी डॉक्टर साहब के सामने रख दें प्लीज. लैपटॉप को कैमरे से डिस्कनेक्ट करें और इसको सामने रख दें डॉक्टर साहब के.
सर हो गया वो.
अनस्टेबल है ना, डीसीसीवी है,
डायरेक्ट
कार्डियोवर्जन है, अनस्टेबल है, मोनाइटिस चलेगा आपको सोचना नहीं भाई.
इसकी मिड तक सैचुरेशन हुआ है यार.
थोड़ी
रेस्पिरेटरी रेट.
Okay, Civil Falcons, can you hear me?
Yes, we can hear you.
Okay, so are you going through the question or what?
Yes, please proceed.
Okay, so I'll ask Kings to go through the question. Please read the question.
Okay, the question is what should be the next step in her management? A. DCCV, B. Emergent PCI, C. Mechanical ventilation, D. BiPAP ventilation, E. RCC transfusion.
And the timer starts now, 60 seconds.
Can you please move back to the question?
Yes, please show them the question. Show them the scenario. Scenario to be on the screen. Yes.
Our screen has been gone. The windows are getting updated.
Okay. Just hold the timer, please. Hold the timer. All right. So can we have the screen back?
Yes. Yes. Now we have got the screen back.
Okay, they have the screen back. So we are going to start the timer. Start the timer, please.
Can we go back to the question, please?
Scenario.
Switch to the scenario.
They are requesting for the scenario.
Yes. Now you have the scenario on the screen, right? 20 seconds, hurry up.
Option A, DCCB.
15 seconds, yes, come on. Are you sure? Should I lock option A, alpha?
Yes, please lock option A.
Lock option A, alpha. Let's see. That's the wrong answer. Never mind, you still have other questions, 9 more questions. You have margins there. So let's move on to question number 2. Read the question, please.
Okay, the patient is placed on mechanical ventilation and subsequently undergoes coronary angiogram, which shows muscle bridge in mid-course of LAD with TIMI-3 flow in all vessels. What should be done next? A. IV amiodarone, B. IV lignocaine, C. DC cardioversion, D. MPI scan, E. Manage heart failure.
60 seconds on your screen now. Come on, Falcons.
Option E, manage heart failure.
Okay, are you sure you want me to lock option E, epsilon?
Yes, please. Option E.
So they are sure they want us to lock option E, epsilon. Lock it. Yes, very well done. And I was hoping for this answer. Well done. And you start off by hitting a 6. You're on the board. Well done. So it's a good chase. All right. Can we have question number 3 on the screen?
Okay, the question 3 is echocardiography of a patient shows LVEF of 25%, normal size cardiac chambers,
Civil
global
Falcons, I'll
hyperkinesia.
request you to stay quiet till the question is over and then you can start discussing. Thank you. Please go ahead.
Interventricular septal thickness of 15, normal aortic valve and alveoli gradient, step C of 8 millimeter. What are the echocardiographic findings most suggestive of A. Acute myocarditis, B. HCM, C. Pulmonary thromboembolism, D. Fulminant myocarditis, E. Chronic persistent myocarditis.
The timer starts now.
एक्यूट करना है या परमानेंट करना है इसका
अरे भाई LVF हमें we cannot see the screen properly. It's blurred throughout.
ये सब तो आ रहा है
We cannot see the screen properly. It's blurred throughout. Hello, the
Okay.
timer is ticking. We cannot see the screen.
Okay, we are going to hold the timer. Please take it back. You'll have 40 seconds. Okay, please technical team fix the issue.
पहले वाला सवाल में भी हमारे साथ ये तमाशा हुआ हम ऑप्शन एक पे अटक गए प्रेशर देख के
Okay, teams, we can hear you as a courtesy to the panel and the whole team. I'll request you to please keep your cool and patience. All right? The technical team is there. They'll help you with that.
नेटवर्क खराब हो गया है
Okay, so I think they are on it and we'll try to make it even for everyone. Don't worry. The panel is also there. Do you see the screen now? Civil Falcons. Falcons? Civil Falcons, can you hear me?
नेट सही नहीं आ रहा भाई
नेट सही नहीं है भैया कहाँ से सुने ऐसे सुनेंगे
नेट सही नहीं आ रहा
इंटरनेट सही नहीं है पेरेंट गर्ल
Civil Falcons, are you there? Can you hear me?
Yes, we can hear you.
Okay.
Although the screen is too blurred to
Okay,
be
so we
appreciate
do
anything.
understand. We do understand there is a problem with the internet, right? And we are trying to be fair with everyone, so don't worry, right? We have the technical team, we have the whole panel, and
अरे इसमें मुझे क्या था इस माइक्रोफोन का मसला होता है फिर इधर से जवाब इधर से बार-बार म्यूट कर देता है बार-बार म्यूट कर देता है इधर से दोनों माइक्रोफोन
um, Okay, so we're back again. We're having a lot of technical issues today, unfortunately. So, can the two teams hear me? Civil Falcons, can you hear me? Civil Falcons? Falcons? Civil Falcons? Can you hear me? Okay, on the other hand, NICVD Kings, can you hear me?
Yes, sir, we can hear you.
Okay, so just I think everyone has to bear with us. It's not easy for the whole team at the moment. It's quite difficult to get hold of the issue. I think there's a serious technical problem going on. So I think I'll have the feedback soon.
Anyway, Assalamu alaikum all. Can you hear me?
Assalamu alaikum, sir. How are you? Good to have you.
Thank you. Good to be with you. And I'll just get back. Unfortunately, the mobile has started ringing.
Sir, actually, it's great to have you here. We were having a wonderful game and the match was on, but we have a technical issue at the moment and we've lost one of the teams. So we are still trying to get hold of things.
डॉक्टर फहद आपको आवाज आ रही है?
So the technical team is trying to get in touch with Civil Falcons.
डॉक्टर फहद आप काइंडली लैपटॉप को डिस्कनेक्ट करा के कैमरे से अपने सामने रख लें प्लीज. कैमरे वो लैपटॉप का माइक और कैमरा यूज कर लें प्लीज. लैपटॉप को कैमरे से डिस्कनेक्ट करके इसको डॉक्टर फहद के सामने रख दें काइंडली. लैपटॉप का माइक और कैमरा यूज हो जाएगा.
All right, I guess we are back after this technical glitch. I'm really sorry for this issue, but I think it was beyond our hands and comprehension as to what had happened. But I think the technical team has somehow fixed the issue in some way, and we'll make do with what we have. All right, so NICVD Kings, you can hear me, right? NICVD Kings? So do we have NICVD Kings now? Okay, so Civil Falcons, you're there?
Yes,
NICVD का ना इस वक्त frozen लगता है image, so there is something over there also happening.
Yes, so I think, sir, the team is back, and since this particular half concerns Civil Falcons, so we'll start with the questions. I think can we have the all right? Can we have the question back? Okay, to take it back. Yeah, so the question was asked already. We were at 40 seconds, and we are going to start the timer from 40. Here you go. 40 seconds now. Civil Falcons, come on, you can do it. 20 seconds.
We go with the D, permanent myocarditis.
Okay, so you want to go with option D, delta. All right, lock option D,
Yes.
delta. Yes, well played under these tough circumstances. It's absolutely falling apart. Technically, we were down and out, but I think that's a wonderful answer. Even in this stressful situation, I know it was not easy for you, but well done. Very good answer. Well played. All right. So can we have the next question? Question number 4.
Okay, the question number 4 is, which one of the following novel markers, if increased, signify a poor prognosis in acute myocarditis? A. Serum soluble FAS. B. Galectin C. C. High IgG titers. D. All of the above. E. None of the above.
And 60 seconds are on your screen.
उससे ये बता Yeah, what about implement?
25 seconds. Come on, Falcons.
Option B, none of the above.
Option E, epsilon. None of the above, right? That's what you want? E, epsilon. Okay. Lock option E, epsilon. Oh. And since they were not sure, they picked the wrong answer by a big margin, I guess. So they've missed this one. But still, they are in the contention for beating the other team. I think they still have a chance. In fact, the game is still on. All right. Question number 5 on your screen. Read it, please.
Which of the following is associated with a favorable prognosis? A. Short clinical history. B. Long clinical history. C. Young age. D. Old age. E. None of the above.
And the timer starts now. The score to beat is 30. Civil Falcons are in pursuit.
Exactly.
25 seconds. 15 seconds approaching. Come on, Falcons.
Okay, C, young age.
Okay, they want us to lock C, Charlie, young age. Lock C, Charlie. Oh, another miss. Well. Clinical questions. All right. So you still have 5 more questions to go. You still have a lot of margin and you need 4 right answers, right? Okay. Question number 6 on your screen.
A, a clinical suspicion of myocarditis is made and cardiac MR is performed. What are the findings of CMR most suggestive of myocarditis? A. Regional or global increase in T2 time with decrease in T1 times and diastolic dysfunction. B. Decreased regional and global T1 times with pericardial signal abnormalities. C. Regional or global increase in T2 times with early apical signal abnormalities. D. Increased regional or global T1 times with late apical signal abnormalities. E. Increase in region or global T2 times with pericardial signal abnormalities.
And the timer starts now. Come on, Falcons. You can do it. Civil Falcons, are you there?
Yes, we have.
Okay, 15 seconds. Come on. 10.
D.
Option D, you want me to lock option D, delta? Should I lock D, delta?
Yes, please.
Okay, they want us to lock D, delta. Lock it. You got close to it, but still missed. Never mind. Now, 4 questions to go. You need to answer them correctly to win. You need 3 right answers to tie. You will still be in the game if you tie. All right. Let's move on to question number 7.
During the course of her admission, the patient develops recurrent episodes of atrial fibrillation with rapid ventricular rate. Which of the following medications should be avoided in this patient? A. Beta blocker. B. Digoxin. C. Amiodarone. D. Sotalol. E. None of the above.
Okay, and the timer starts now. 60 seconds.
Sotalol, arrhythmias के chances के लिए. D. Sotalol. D.
20 seconds. Come on. This one is important. Come on. Which option? I couldn't hear you.
Option D.
D. You speak a bit loud because
Sotalol.
we are having difficulty. So D. Sotalol, right? Delta. Lock option D, delta. Oh, so it's a flurry of misses. Come on. Civil Falcons, what's going on? All right. Now you can only tie, but that will still keep you in the game, in the tournament. All right. Moving to question number 8 now.
Question number 8. Endomyocardial biopsy is considered to aid the diagnosis. Which of the following will fulfill the Marburg criteria? A. 15 infiltrating leukocytes per mm, preferably T lymphocytes and 6 macrophages. B. 10 infiltrating leukocytes per mm, preferably T lymphocytes and 8 macrophages. C. 16 infiltrating leukocytes per mm, preferably B lymphocytes and 2 macrophages. D. Minimum of 14 infiltrating leukocytes per mm, preferably B lymphocytes and 3 macrophages. E. Minimum of 12 infiltrating leukocytes per mm, preferably T lymphocytes and up to 4 macrophages.
And the timer starts now. Well, that's a short pitched one coming right at their face. Let's see. Come on, Civil Falcons.
Option B. Bravo.
B beta. Beta. B beta, that's what you mean.
Yes, please. Option B.
Okay, so he has taken a swing. He wants me to lock B beta. Lock it. Oh. Well. So you've definitely missed this one. And with this, I think we now also know the outcome of the game, but I think we just have 2 more questions to go. And I think still the idea is to learn from each other. So it's a good effort. And it's been pretty difficult and hostile stuff going on. So I think we now move to question number 9, second last question of the innings. Read it, please.
Question number 9 is...
Please switch your mic on, NICVD.
Question number 9 is: a diagnosis of giant cell myocarditis is made based upon multinucleated giant cells on endomyocardial biopsy. What immunosuppressive therapy should be initiated? A. Fluorocortisone plus azathioprine plus cyclosporin plus infliximab. B. Prednisolone plus azathioprine plus cyclophosphamide plus OKT3. C. Prednisolone plus azathioprine plus cyclosporin plus OKT3. D. Prednisolone plus azathioprine plus cyclosporin plus 𝐈.𝐈.𝐺. E. Prednisolone plus azathioprine plus cyclophosphamide plus 𝐈.𝐈.𝐺.
And your 60 seconds start now. Falcons, Civil Falcons, you can keep your head held high. Come on, give it a shot.
Option E. Epsilon.
E epsilon. All right. They have gone for option E epsilon. Let's see. Lock it, please. E epsilon. So I think he just went with it. Never mind. We now move to the last question. Question number 10. Read the question, please.
Question number 10. The patient gradually improves clinically and after hospitalization of 3 weeks of being considered for discharge, what advice should be offered to the patient in terms of exercise restriction? A. No need of exercise restriction. B. Exercise restriction for 1 month. C. Exercise restriction for 2 months. D. Exercise restriction for 6 months. E. Exercise restriction for 1 year.
All right, your 60 seconds are on your screen.
Myocarditis for 6 months. 1 year to. D बोल. D delta.
Approaching 20 seconds.
Option A. No.
Okay, you want to go with option A alpha.
Yes, please.
Okay. Option A alpha. Lock it, please. Oh, yes. definitely the wrong answer. The correct answer was D, exercise restriction for 6 months. And with this, we now come to the end of this match in the Super Sixes stage. And the news is NICVD Kings have won this match. And Civil Falcons, I think they've lost, but everyone was under duress. The things were getting quite difficult. We were having technical difficulties all over, but somehow the technical team got hold of things. The internet was making it very difficult for us, but all's well that ends well. That's what I'm going to say. With this, I will take the panel of experts on board, and we have the umpire for today, Professor Mohammad Ishaq Saab. Sir, are you there?
Yes, sir. Assalamu alaikum. Sorry, I missed the early part because I was on another meeting. And then there was a lot of disruption today in the internet. And but nevertheless, both teams played very well under tough circumstances, under duress. The second team, there was a lot of disruption, frequent disruption, which should not have happened after such a long experience that we have now of this league. The performance by Civil Falcons was disappointing, but nevertheless, as you said, they should keep up their courage, and efforts should be made to improve their knowledge. Both the questions, I happened to review them late last night, were appropriate to fellowship level, and this is something that we come across daily. Obviously, one or two, or at least sometimes three questions are slightly difficult, but all the 10 questions cannot be simple. So 2-3 questions were difficult, but I think this is how the competition runs. So far, we have similar kind of composition, 2-3 difficult, 2-3 very easy, and bulk of them 50% and more average, which everybody should have known. So I think, again, thanks to Wilson, thanks to Hamza, and my very distinguished colleagues are around. I could see Professor Bilal Mayuddin always ready with firing and questions and comments. So I think, as we always say, it's a great learning experience for the fellows as well as for the teachers, for the faculty. And I think at the end of the day, when we compile all these questions into booklet form, it will make a real treasure of knowledge for our students and fellows in training. So very well done, everybody. Special thanks to Hamza for coordinating, for conducting it in a very, very palatable, very smooth and pleasant way, making it, very pleasant for the competitors, encouraging them. But he's always a bit disappointed when he gets the wrong answer. So, and to Messrs. Wilson, Pharmaceutical, Hamza, unka bhi, aap log, thank you very much for organizing this activity. Coming from a pharmaceutical company, this kind of activity is really something which we really need to appreciate and encourage. And I hope they are bringing up another Super League after some time, which will further enhance our knowledge. So over to my other distinguished colleagues for their valuable comments. Thank you, Hamza.
Thank you very much, sir. It's definitely a ray of hope for all of us. And I think as the stakes are going up, no doubt the competition is getting tougher, and the questions will also get tougher as the time goes on. And at the end of the day, it's learning for everyone. And we have the other umpire today. We have Professor Abdul Hamid Siddiqui. Sir, can we have your thoughts as well? Is Siddiqui Saab there? Okay, and if in the meantime, I think we also have Professor Bilal Mohyuddin, sir. Can we have your thoughts, because he's been showing us his glimpses. It's always great to see him around. Is he there?
I'm very much here.
Sir.
And thank you for sending the invitation, and thank you for this lovely occasion. देखो मेरे हिसाब से when this competition is held, we are all winners. And when I say we all, so you who are conducting, we who are listening, and they who are participating, we are all winners because we all learn something new. MRI, I'm sure, is something that a lot of us also got stumped on. But I would just simply say, okay, well done to the teams who come up with these questions. And the idea is, of course, you create an environment which is challenging for the others. So as you have all said, okay, yes, it is going to move forward, and we will move forward. As far as what future holds, the future is bright. Why I say that? Because they are all struggling and learning better. And I can without doubt say that these are all energetic young individuals who, in whose hands, when they are looking after us, I will be confident, because they are struggling to improve themselves. जो कौमें अपने आप के लिए बेहतर के रास्ते ढूंढती हैं, वही कल को आगे जाती है. So win or lose is something different. ये सुपर लीग बेशक को क्रिकेट होगी, लेकिन ये पाकिस्तान की क्रिकेट नहीं है, ये एकेडमिक्स की क्रिकेट है. And mashallah, Falcons, you have done well, and Kings, you have done well, but don't let the wins go to your head, and don't let the falls take you down. All, जैसे कहते हैं ना, मैदान जंग में जीतता वही है जिसको गिर के खड़ा होना आता है. So you will win, and I hope to see you all in Lahore in November, and participating and learning at this conference, because there are going to be some rather interesting things, and we'll be having international friends also coming in. So मौका होगा सीखने का. And as I said earlier, उस वक्त I don't know, Civil Lines was not at that time, Civil Falcons were not on board at that moment, but kindly get on board, send in your things. If you have any difficulty, the Wilsons will look after you. So there's many of ways in which we can be there. So all the best, mashallah, and thank you, Wilson, for doing such a great show. And as always, the compere, the handsome, glorious man who can do so many things in cardiology. And this is one thing, again, that you're doing so fantastic. See you all very soon. Take care.
Thank you very much, sir. It's always great to have you, and I get fascinated by this aquarium that you speak from. I wish I had one like this too, but I think we're all taking a leaf out of your book and the books of our seniors, and we're all learning. That's the point of this show. And what beautiful words from Professor Bilal Mohyuddin for everyone and for the show as well. And with this, I think I'm going to move to Professor Abdul Hamid Siddiqui. Do we have him? So, Siddiqui Saab, are you there? आपका इंतजार है. I think if so.
Yes, I'm here.
Oh, great to have you.
I think these scenarios are very good, although as Professor Saab mentioned, they were a bit lengthy, but I think these newer things are required, and the registrar and those who are doing training cardiology, they need to keep themselves abreast of the new developments and new procedures which are being conducted. So it's very good to have these scenarios, so in order to keep the fellows update. And obviously, sometimes it's difficult and it's also low scoring game, but anyway, they have to work hard for that.
Thank you very much, sir. I think it's always great to have the panel of experts, and what a beautiful game we had, barring the technical difficulties, but we still got through it. This is what teamwork is all about, and I think this is what makes you successful as an individual, as a professional, and it's always about learning and what you can achieve. Winning and losing is part of the game. So today, NICVD Kings have won. Congratulations to them. But I would also like to congratulate Civil Falcons for the fight that they put up. And it's always going to be victory when you are taking home so much of knowledge, and especially from your leaders and your seniors who are always there to supervise you. So it's a wonderful concept, a wonderful game. And with this, we are now going to come to the end. It was a great game again. And I look forward to seeing you soon in the next game, the next match. And it's going to be victory for everyone. That's one thing for sure. So till then, it's Allah Hafiz from my end. Have a good day.